So with your indulgence, it's a great privilege for me to introduce Governor Cooper, who certainly does not need any introduction. But he was born and raised in Nashville County and earning undergraduate law degrees from UNC Chapel Hill. Despite that, we're good friends. He practiced law for 18 years in Rocky Mount in North Carolina and entered public service in the North Carolina State House and State Senate, where he fought to raise teacher pay, reduce class sizes, and wrote North Carolina's first children's health insurance initiative. After being elected Attorney General in 2000, he protected North Carolina families for 4 consecutive terms. He oversaw a sharp decrease in crime and fought for consumers by advocating for low utility rates and putting predatory lenders out of business. As North Carolina's 75th governor, he's working to make lasting investment for our future. He wants to ensure that North Carolinians are better educated, healthier, and more prosperous for generations to come. Since taking office, Governor Cooper has worked to create thousands of new jobs. He's focused on boosting public education, tackling the opioid crisis, revitalizing rural communities, and making sure North Carolinians have training to fill better-paying jobs that will require more skills. After Hurricanes Matthew, Florence, Michael, and Dorian devastated parts of our state, he fought for resources to help North Carolina recover smarter and stronger than ever. Governor Cooper is committed to ensuring that state government looks like the people it represents, and he's appointed the most diverse cabinet in North Carolina history. And certainly we're so glad you appointed Secretary Cohen to be the Secretary of DHHS. He believes that if we work together, we can build a strong North Carolina that works for everyone. So please help me welcome Governor Cooper.
Well, good morning, everyone. Thank you for coming. I know many people in this room who've contributed to the health of North Carolinians for years, and I'm grateful for your service. I thank the Biotechnology Center for allowing this conference to be held here today. I work closely with them in working to attract good-paying jobs to our state. We really are taking off in the life sciences area, and we're excited about the innovation and entrepreneurship economy in North Carolina, particularly as it involves healthcare. Glad to see Senator Floyd McKissick here, great senator from Durham, and Senator Terry Van Dyne, who is here from Asheville and who is going all over the state these days. And Victor Zhao, our longtime friendship is appreciated. It was great to see your much better half of Ruth here today. We know that even though you have a national profile at the National Academy of Medicine, that your heart is in North Carolina and that you care deeply about what happens here. We're grateful for that. We're getting near Thanksgiving, and I am thankful to work with, by far, the best Secretary of Health and Human Services in the country, in Mandy Cohen. One talent that I think I have is attracting good people into where I work. You got to do that to make up for your own deficiencies. But I really outdid myself with her. And I'm grateful that she is here. There is no question that North Carolinians are healthier because of her good work. And although we have both had to deal with unnecessary partisan fights, we know how partisan healthcare can become. And that really is hurtful at the end of the day. But we've continued to strive to move forward, and I know she will talk with you a little bit today about how we're dealing with transformation and expansion, but still succeeding in many areas, even though we're having some debates and disputes in those areas. With health, you're going to continue to get old. There's just no question about it. And you got to keep yourself as healthy as you possibly can. But it reminds me of what has been happening a little bit at my house, having moved into the North Carolina governor's mansion, which for a guy who grew up in eastern North Carolina, this is way above my raisins. But Kristen and I are enjoying it. And for those of you who have been there, you see portraits of former governors that are lined up downstairs. And the law requires the governor, I think at least by 2 years into your term, to begin the process of making sure that you have a portrait done so that the state can put it up in the executive mansion. I'm not that interested in it. Makes me a little uncomfortable, but it's something that by law is required. Well, now you all know that I'm nearing my third year, in completing my third year of my first term. We'll have a second one. But my wonderful wife, Kristen, who is a great lawyer and who is spending time going to all 100 counties. She has been to 80 so far and done events in 80 of them. And she's been spectacular, particularly in the area of children's health and hunger. We're doing a No Child Hungry event tonight, and so grateful for her. But she's been on me about, honey, you need to get time to start taking your pictures and pick somebody to do your portrait. I don't have time. Let me do the budget thing. You take care of it for me. She says, honey, you've got to do this. And I said, I've got a budget meeting over there. She grabbed me by the arm. She looked at me and said, it's not getting any better. Those of you who know Kristen know that to be absolutely true. I think she sort of enjoyed saying it, but it got my attention, so the appointment's set and all of that kind of stuff. I hadn't thought about it that way. I have a mission for North Carolina. I say this every day, multiple times a day, to my staff, to my cabinet. I want a North Carolina where people are better educated, where they're healthier, where they have more money in their pockets, and they have opportunities to live lives of purpose and abundance. That's what I want. Everything we do in our administration, we want that to happen. And we know a critical part of that is health. The rest of it sort of falls apart if people aren't healthy and have the chance to prevent disease and to prevent accidents that can send their life sideways. People have to be healthy in order to try to get a good education and to live lives of purpose and abundance. So health is connected to every aspect of a person's life. I wanted to just hit a couple of highlights of some things that we're working on regarding health. And I'll start it out by talking about our opioid action plan. We know substance use disorder, most every family has been touched with it in one way or another. And our opioid action plan that we put forth in 2017 increased funding for evidence-based treatment and training for issues related to the epidemic and safe prescribing. We pushed legislation that was passed, and we've already seen notable success. Many of you have talked to that parent who has lost a child to opioid overdose, or a family member, or a friend. We know how tragic it can be. We know how disruptive it can be to lives of anybody who cares about the person who is struggling with substance use disorder. When we started this thing, the opioid epidemic claimed 5 lives a day in North Carolina from unintentional overdoses. Since the plan has been launched, along with our Opioid Action Plan 2.0, unintentional opioid-related overdose deaths have decreased by 5%, which is a positive thing. The graph had been going up, 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 up. Now it is beginning to dip. We have seen opioid dispensing decrease statewide by 24%. The emergency room visits for opioid-related overdose have declined nearly 10%. And notably, the uninsured and Medicaid beneficiaries who've received opioid use treatment since we put the plan in place has increased by 20%. So even when we've got a state that has a lot of people who are uncovered and we got to figure out ways to deal with that, we have had success, and we have to do more to build on this success. Expanding Medicaid will help that significantly, but I'll talk about that in just a minute. Our Opioid 2.0 action plan updated the 2017 plan with feedback from partners and stakeholders, and now includes local strategies that are going on right now in counties, coalitions, stakeholders who are working together. I'm also proud of our early childhood action plan. We know more than ever how much 0 to 3 matters. When brain formation is going on with that child, early childhood education and health care is critical to success of that child. And the more science we see, the more overwhelming that is. North Carolina has seen that, and Governor Hunt, one of my predecessors, started Smart Start. We have worked very hard to have 4- and 5-star child care agencies. We know that it's not just babysitting, that we've got to have interactive education with our children, and we've got to make sure that they are as healthy as possible. We put this opioid action plan in place because we know too many babies are born in our state with the odds stacked against them. More vulnerable than others because of social, racial, and economic factors. And we are on target to dramatically reduce disparities in infant mortality by 2025. We have to do that. We must ensure that babies and children and young families have access to high quality, affordable health care services. We've got to increase the number of our children enrolled in Medicaid and Health Choice to access wellness and visits and home wellness visits and immunizations. And of course, we've got to expand Medicaid to hardworking people who need access to critical preventive care. In our schools, we know that we have to address health issues there. Spend a lot of time talking to our teachers and other educators across our state. When I go into a public school, I come out smiling because I know the good things that are happening there. We need to lift up our educators. We need to give them respect. Instead of sweeping corporate tax breaks, we need to be investing more in our teachers and principals. It's interesting that I had a discussion with a bipartisan set of legislators, and boy, we had some differences about public education and whether we should be slapping letter grades on schools or putting money into unaccountable private school vouchers. I guess you see how I feel about that. But we agreed on 2 things that would improve public education: a good teacher in every classroom and a good principal in every school. You got to get the pipeline of people to do that. So you got to pay them more. You got to show them respect. When they get their master's degree, you got to reward them. You can't charge them for when they have to take a leave day, and you can't charge them to pay for their substitute like they're doing now. You've got to greatly expand teaching fellows scholarships across this state. They have to be robust. They have to recruit our best and brightest and recruit diversity. When we tell young students coming out of high school, we think education is so important that we will pay 4 years of your school if you'll give us at least 4 years back in teaching in our public schools. You are not only going to get the top of the class, which when we were starting this, that's what we were doing until it got stymied and changed, and we've got to do it a lot better and get back to what we were doing and more. I was on one of the first interview panels. I said, my gosh, we were getting the top of the class. The very best teachers who are agreeing to be public school teachers in our schools. We've got to continue to encourage that and to push. But we know that these educators in schools often face kids who have had early childhood adverse experiences, who have been dealt the bad hand because of where they live, or their economy, or their race. And we often expect our schools to magically educate them and fix them. And it's hard to teach a child when that child is hungry. And so we've got to approach this holistically. I was in a western county talking to educators there, and they send a health forum home with parents at the beginning of the school year. And the superintendent told me that this was the first year, and this was like a year ago or 2 years ago, this was the first year where parental concerns about their children's mental health exceeded their concerns about their physical health. And so what I have proposed is more flexible funding for schools so that we can have more personnel that would help. Most of the teachers will tell you, I've got 2 kids in my class who need mental health treatment desperately. And sometimes they just cannot find that coverage. So we need more social workers. We need more psychologists. We need more counselors in our schools. And I have proposed budgets for that, and we need to work to do that. We also know, when we're talking about health, that climate change is a massive factor. It is real, it is here, and we have to do something about it. I talk to my kids about their generation may be the last to be able to do something meaningful, and we've got to get the ball rolling in our generation. I have, through executive order, put together a clean energy plan, and we unveiled it in September, and it says that it recognizes the threat of climate change. We are on a path to reduce carbon emissions by 70% by 2030, and to get us carbon neutral by 2050. And it does it in a way that we can grow good paying jobs and support our economy and have reliable, renewable ways to produce and generate the power that we need. We've got a lot of people pulling together for that clean energy plan. We might have had a president that says we're out of the Paris Accords. I said, not North Carolina. We're going to continue to strive toward that. I've joined the Climate Alliance with a number of other states, and we are moving forward. We also know rural health is an issue. 40% of our rural hospitals are in the red right now, and it's hard for us to attract people to rural areas. We have a strong rural revitalization plan. One of the major things we've got to do is get high-speed internet access all over North Carolina and in rural areas. We know how that affects health. We know how that affects education. We're working to attract businesses to rural counties. We have a Hometown Strong plan that sends teams into these counties who are often short-staffed to help them address their challenges, and we know that matters for health. And once again, Medicaid expansion is going to play a big role in helping to improve rural health. So, let's talk about Medicaid expansion. We are sending billions of dollars of our taxpayer money to Washington. That money's going to 37 other states to help insure people there, but not to North Carolina. We have an opportunity to provide health insurance to 500,000 to 600,000 North Carolinians if we just said one word. Yes. Yes, we'll take it. We can take some of that tax money back that we've been paying to Washington. Not only will we make so many working people healthier, we will create 30,000 to 40,000 jobs. We will reduce private insurance premiums by 7 to 11%. How do we know all this? It's happening in these other states, has been for the last 5 or 6 years. We have the data. We know what is working. We could have that happen in North Carolina. A guy by the name of Mike Pence, as governor of Indiana, expanded Medicaid. I was talking to Governor John Kasich, former Republican governor of Ohio, and after I won the debate over which state was first in flight, they had the bicycle shop, we flew the plane, case closed. He looked at me and said, thank God we expanded Medicaid, and started talking about a 54% decrease in opioid overdose deaths in Dayton, and talking about the increased mental health capacity that was there. We know it will help our rural hospitals. We got a plan here, 90% will be paid by the federal government. The other 10% is going to be paid by insurance companies and hospitals, because it'll increase their bottom line, and they know it's a good thing for the state to do. It's time for us to do it. I would encourage you to go to healthcarecan'twait.org if you haven't been already, healthcarecan'twait.org. Plug in any county. Find out how many more people will get health insurance. Find out how many more jobs are going to be created. Find out how much economic investment is going to come to that county. This is why law enforcement, chambers of commerce, Republicans, Democrats, all are coming forward to say it is past time for North Carolina to do this. And in this partisan political world, you hear a lot about morals. I think healthcare is a moral issue. I'm a person of faith. My Bible tells me you try to heal the sick, you try to welcome the stranger, you try to help the downtrodden. I was sitting beside an early childhood educator at a little table with a little chair in preschool, one of our 4- and 5-star child care centers. She had a tear rolling down her cheek because she was having to declare bankruptcy because of a medical emergency. And you know that 1 in 5 of our early childhood educators have no health insurance. Many of these child care agencies, in order to be able to keep fees affordable for parents and to meet the demands of 4- and 5-star requirements, they don't provide health insurance for their employees. This woman happened to have a master's. She could be doing a lot. She could be a public school teacher and make more money. We have to do more to improve our pipeline of early childhood educators and not just our teachers. And Dr. Cohen will talk to you about that, and that's part of our early childhood action plan. But that is not right. It is not right. Every person should have the availability of affordable, quality health care in the richest country in the world. Come on. Now, we can have a debate about how much the government should be involved in this, clearly. But right now, all of the partisan politics, we have a path that is narrow. We can close gaps under the present system. We have to continue to make the system better. The system needs to transform. We need a value-based system. Fee-for-service, we know, can help run healthcare costs up in a way that we don't need to be doing, but we need to do it in a way where we maintain our providers who are continuing to provide for our lowest wealth people. And we can do this thing. We have to do this thing. And it takes strong leadership. And it takes people talking about it. It takes people, there's Wendy over here, a county commissioner, and you know, you guys telling this story, and chambers of commerce stepping up and saying, this is something that we should do. We don't need, the CEOs aren't telling me that they need another corporate tax break. They're telling me they need quality people in their workforce. They need healthy people in their workforce. They've got jobs that are open. We need to be doing that. We're working to try to fill that workforce and deal with those healthcare issues. I've issued an executive order regarding family leave, saying that when a new child comes to a family, that state employees should be able to take time with that child. And now we've got the university who's done it, the community colleges who have done it, a lot of private businesses who are doing it. That's the kind of thing that we need to be doing. I issued an order, I call it Work First, with our people with disabilities. Some of the best employees you will ever find are people with disabilities who want to be in the workforce. And we are trying to encourage that and to make sure employers know this and find jobs for people. I issued an executive order saying we're not going to have any tax dollars go to any organization that promotes conversion therapy that hurts LGBT youth. We can do things time and again to make people healthier in this state and do the right thing. I am excited to live in the best state in the country. When I'm talking to companies about coming here, the quality of life, the low cost of doing business, we have the greatest community colleges and universities in the world. We have the warmest people. It is a place where innovators and entrepreneurs can succeed. We're sending a message now. We weren't a few years ago, but we're sending a message now that North Carolina values diversity, that our state government should look like the people that it serves and protects, that we know diversity makes us stronger, makes us better, that we are open for business, that we are welcoming. All of those things we're doing now. But we know North Carolina needs to be healthier. And I'm depending on you all to have all of the answers for me at the end of this and help us get it done. There are great minds in this room. There are people who have great compassion in this room. There are people from the private sector. I particularly thank our people who are so smart working in the public sector who could be making a lot more money doing other things, but they've decided to like Dr. Cohen, to give their lives to public service, and we've got to be grateful for that. I believe that North Carolina is going to see bright days ahead and be even better. And hopefully, my mission statement of having a better educated, healthier North Carolina with people being more prosperous will come true. Thank you for allowing me to be here and being with you today. I appreciate it.